We have Athletic-Kinetics with us, and that includes Chris and Daniel and Austin. They are all doctors of physical therapy, and they are doing some great things on just helping us all be better runners. They're targeting those busy athletes, which I think we could all raise our hand, and that would define us. And just helping us be better. Carly and I had the pleasure of working with them. Kelly Pritchett too, our dietitian, she worked with them as well, and she's actually the one that introduced us to them. But they helped both Carly and myself just make some tweaks. And if you've been following us on Instagram, you've seen, or if you've been inside of our network, we've talked about it as well. So I'm going to turn it over to Daniel and Austin and Chris and let them take it away, unless Carly, you want to say anything before we get started?
Nope, I'm just eating food over here, listening, having fun. So I'm excited. I'm ready.
All right.
All right.
All right. Thanks so much, Christy. So the presentation we're going to do today for you guys is called Find Your Form. And it's an introduction to running gait analysis. But before we get going, and if we can do this in the chat if everyone wants it, I always like to kind of gauge if anyone has had any experience with running gait analysis or with videoing themselves running or anything. And so go ahead and if you can find the chat, type in yes or no, or kind of your experience with running gait analysis, and I'll kind of give an intro as you guys are doing that. So Austin, Chris, and I are doctors of physical therapy, and we went to school together at Northern Arizona University. I'm going to give you guys kind of an introduction, and then Austin will take over a little bit from there. So we'll introduce ourselves, then we're going to go over the what and the why of running gait analysis. We'll give some gait analysis examples with some case studies, and we're going to actually use some of your coaches as case studies with that and go over some important things there. And then we'll talk about cadence, which is something that you'll be able to apply kind of right away to your running form and your gait, and then we'll kind of go over next steps and things that you can be doing, kind of going from there. So really big objectives for you to take away from this presentation are understand why gait analysis is important, understand how gait analysis works, kind of the logistics around it, understand the resources available to you, and then learn how to use one important gait modification, which is going to be cadence.
Nice. All right. So we want to tell you guys a little bit about who we are and what we do. So at Athletic-Kinetics, we help people run pain-free at their highest level by analyzing their running gait and optimizing their form. So we love helping runners just like you guys at WAHOO Runners who want to run faster and longer, people who want to stay healthy and they want to enjoy this amazing sport of running for years to come, many years. And one thing that we've ran into a lot with our athletes that we've worked with and our patients, as well as other runners, is that they're very busy people, as Christy was mentioning. So a lot of you, I'm sure, can relate to, you're trying to balance all of these things in your life. Like you have these running goals, but you also have all these other things going on, like with your work and your career, or being a spouse, or maybe being a parent. We know a lot of you guys probably are very much about getting outside and hiking and enjoying nature. And so what we want to do is give you guys proven but simple strategies and very practical strategies that you can use right away in your run. So things that are going to fit into your busy schedule very well, and things that will make a big difference for you. And stick around later too, because we're going to give you guys access to a free program, and we'll tell you guys about that. So as you can see in the picture here, so there's us with our goofy hats. So that is the three of us at Northern Arizona University. And that's in Flagstaff, Arizona, in case any of you guys have been up there. So that's where the three of us met in grad school. And so this is pictured after we graduated from there. And the three of us just became great friends, and we stayed great friends after. And so I'm actually in Reno, Nevada currently. Daniel's in San Diego, California, and then Chris is in Bend, Oregon. And so the three of us, we always knew we wanted to collaborate together. And so we knew we wanted to have a big impact on runners. And so that's how Athletic-Kinetics was born. And in addition to our experience clinically as PTs, Each of us also have a lot of experience training athletes across the whole spectrum, including professional, semi-professional, as well as all kinds of recreational athletes. So with our huge passion for runners, we just kept seeing this huge need for running gait analysis that was much more simple and practical, as well as running form retraining. And so what we've seen personally, as well as in research, is that even just small things in running form, they can hold back your efficiency and speed. And these things can place excessive stress on certain areas of your body, depending on what is off. And so making these small adjustments and making the right adjustments to your form can help just everything fall into place. And those things can lead to not only immediate improvements, but lasting results.
Yeah, and like Christy mentioned, the three of us are doctors of physical therapy. My name is Chris again. We all work in outpatient orthopedic physical therapy clinics, and we are all specialists in running analysis. And like Austin alluded to, we wanted to develop a standardized way to analyze runners' running technique. We wanted to look at the different variables that really apply to performance, running economy, as well as injury prevention and recovering from an injury. And if you've looked at technique or looked at some things online, if you Google things about running technique, you oftentimes find conflicting advice or advice that is complicated. And running technique can be complicated. And so understanding that, we really wanted to distill all that information and make it really practical and really easy to use for the runners that we work with. So we took a deep dive into the research. We took over a year to look at the research. What is the research telling us that's going to maximize people's performance, running economy, and injury prevention? And that's how we narrow down the variables that we look at that hold the greatest weight when we're analyzing someone's running technique. And the big overarching concept that is woven into our philosophy, no one perfect way to run for every runner. So that means every runner has their own unique movement signature, I like to call it. And every runner is unique, and there are unique ways for everyone to optimize their specific technique. And in fact, to take it a step further, it's important to vary your technique in certain situations and do things on the fly, such as when you're on different sets of terrain, when you're running at different speeds. It's important to vary your technique throughout even a given. And so it's our own process to analyze, running, mobilize, activate, and integrate. And so when we look at this process, we look at analyze. So what you can't see, you can't change. And so it's important that first we do a video analysis and see what types of things you're doing really well and what types of things improve. The second step is mobilize, where we provide a customized pre-run routine and a cool down routine that mobilizes and activates what you need based on specifically what we found in your analysis. And then the next step is activate. So running, which is pretty awesome, has a predictable set of performance demands. So not all sports are like that. Running has a very predictable set of performance demands, so we can activate things that are specific to you, that are very specific to running. So prepping your body, priming the nervous system for the same muscles and movements that you're going to use for your run. And then in that integrate, that last step, that's when you're integrating specific variables in the running technique that you need to work on. And so a little bit later, we're going to show you how Carly and Christy used our process so you can apply it on your own.
Cool. All right. So our main goal today is to give you guys some valuable and practical information about running gait analysis. So we're first going to start with a what and a why, the reasons for running gait analysis. And then we're going to go over some basics of running gait analysis. We'll look at stride, hip extension, and knee alignment. And that's when we're going to use those case studies. We'll explain more about each of those as we go through them. And then at the end, we're going to cover cadence, which is a really practical and applicable running variable. And then for the sake of fluidity, we'll have everyone hold questions until the end. And then at the end, we'll do a Q&A where you can ask whatever you like, whatever is on your mind or pressing about anything we've presented on. Okay, so let's go over the what for running gait analysis. What is it? And essentially it's breaking down running form using slow motion to detect and identify biomechanics that could be contributing to increased injury risk or decreased running efficiency. And so we do this, we've seen it done best with a treadmill. So that's typically what we'll use, but you can also do it outdoors as well. The treadmill is nice because you kind of get a good look for a minute or so if someone's running mechanics, but at the same time, you can do it from different angles outdoors as well. We then use a running gait analysis app to then kind of draw angles, and we'll show you guys how we do this, but draw angles and lines and that sort of thing to break down the biomechanics really specifically. Why should we do running gait analysis? So ultimately what you can measure, you can improve upon. So if Chris mentioned this, if you can't see something, then you're not going to be able to improve upon it. And so this is where we look for biomechanical issues and then make adjustments. And it's to make you more efficient and put you at less risk for injury, because ultimately we want to run for years to come. That's kind of our premise is if you can correct little things that might make an impact later, you can then run for longer with less injury.
Awesome. Okay, so Daniel's going to switch over. We're going to show you some really cool case studies with videos. So while he's switching over, so basically what we're going to show you here is just a snippet of our running gait analysis process. So we're going to show you guys 3 of our really practical but simple methods. So one of them is stride length. The other is hip extension, like we mentioned. And then the third is knee alignment. And then we're going to finish by talking about cadence and how you guys can use one of the most powerful techniques into your own run. So the first thing we're actually going to look at is Carly's running gait here. And so we had a lot of fun doing Christy and Carly's running gait analysis. And we had to get picky because Carly is doing a lot of things really, really well. One thing that we found that was a big area for improvement for her was in her stride length. I see that. Time to make fun of the coaches now. No, you guys did super well. We did have to get picky. But so for stride length, how we analyze that is we pause the video at the first point of contact when the foot hits the ground. So that's what Daniel just paused that video at. And so what we look at is how close is that point of contact where your foot is contacting the ground to your center of mass. So that red line that Daniel just drew there, the vertical one, that's the approximate center of mass. And we're looking at how far or close is that to the contact point on that heel. So the farther away it is, that means that the stride length is a little bit longer and vice versa. So ideally, we want to have it close underneath you because that's a much more efficient position. So if you're overstriding and that foot is out away from you, then that leads to things that we'll talk about as far as impact force. But that red line that Daniel just drew, maybe you can draw it one more time, Daniel, across the lower leg. That he'll just now draw right now. So that is a representative of the tibia, the lower leg bone. And what we're looking for there is for that line to be close to vertical or close to straight up and down, just like that green line Daniel drew. So you can see with Carly, her tibia was inclined a little bit there. And so she did have a little bit of an overstride. So what that means is that she was placing a little bit more stress on her ankle joints and her knee and her hip and low back. And so what we're going to show you is after she worked on some of these drills that we're going to teach you guys later, we're going to show you what happened with her stride length. So Daniel's going to pause right about there. So right as the foot contacts the ground, right there. And so you can see, so when we increased her, Carly's cadence, we found that ideal cadence, Her tibia was actually spot on, straight up and down. And we weren't even purposely having her think about changing her stride length. But sometimes we use variables to indirectly change something that is very meaningful. And so you can see there that the point of contact now is much closer to underneath her center of mass. So now her muscles are not having to work as hard. She's not getting those braking forces being placed upon her body. So her injury risk has come down, as well as her speed and efficiency should be kicking up there. And one of the myths that we wanted to kind of bust for you guys is something that we hear from our runners is, so having a long stride length is not actually a bad thing. Overstriding is what's not good. So a longer stride length, that correlates to an increased speed, right? Because you're covering more ground. So you can have a long stride length as long as you are having that tibia straight up and down when your foot contacts the ground. And yes, I just saw that, Christy, you're absolutely right. Like her foot strike kind of changed naturally for us as well here. She kind of went from a pretty pronounced rear foot strike to a midfoot strike, which for longer distances is going to mean a lot better running economy, as well as just generally less impact force and less braking force. So awesome. So now Chris is actually going to show you guys Christy's running gait and her positioning at toe off.
Yeah, so we'll look at this toe off position, and again, Christy, your form is amazing, and we just found a couple of subtle things that we looked at. And with this toe off position, if we go, the toe off position is right before the back toe leaves the ground. And what we see is what we call triple extension, which just means the leg is driving back behind the body. The hip, the upper thigh bone is going back behind the body, and the tibia is going back behind the body, the lower shin bone there. Everything is driving back and pushing into the ground. And normally we want to see it in just that standardized way of getting that hip extension. We typically see some of that hip extension or the hip back behind the body. We see that coming from a combination of areas. One of the areas is a little bit of a lumbar low back extension, an arching of your low back. And another thing, is the thigh bone, the femur going back behind the body. And then another one is a little bit of a rotation at the level of the pelvis. So those three things usually combine to get around 15 degrees or so of the leg going back behind the body. And what we noticed in Christy's form here was that there's just potentially a little bit more of that motion is coming from the low back. So maybe just a slight arch in that low back. And we hypothesize that the hip extension might be a little bit limited, and the muscles on the front of the hip could be a limiting factor in that, and the hip getting fully back behind the body. And then we'll take a look at another runner here running on pavement, and we'll just show you that leg going back behind the body over ground. And I also wanted to show you the knee drive of the opposite leg. So whenever we have this toe off position, we have the opposite leg up in front of the body. The hip is driving up, the knee is driving up, and that toe, that ankle, those toes are driving up. And we call all of those things triple flexion, and then we call that back leg triple extension. And so you can see this back leg nice and straight, that hip is going back behind the body, that ankle is pushing down into the ground. And what we see in this trail leg is that you're using your glutes, you're using your hamstrings to push down in a way into the ground. And it's just going to drive you forward. It's going to have this rubber band effect to just slingshot your body forward when you're pressing into the ground. And so that's by pressing that leg into the ground, by working on that leg getting behind you, that's going to improve your speed and efficiency. And when you can balance those areas that get your leg behind you, that's going to reduce your risk of injury in the low back. So now Daniel's going to teach you guys a little bit about knee alignment.
Yeah, so I wanted to emphasize again. So we had to get really picky with both Carly and Christy because their form looked really good. Give you guys a background. We're looking at, we kind of have a standard 8 things we're going to look at with everyone, with every runner, and then another 5 to 10 things depending on the individual runner and kind of what level they're at. So we kind of looked at 15 to 20 things when we were looking through their gait, and we found like 1 or 2 things on each of these to be picky with them. So they looked really good. So what I'm going to do is I'm actually going to show you something they both did really well. It's one of those, like I said, 10 or 15 things they did really well, but it's something that's really important, I think, for me to kind of explain to all of you, because it's something that is really highly correlated with injury. And so we're going to go to mid stance here for Carly. We're going to look at her knee alignment. So mid stance is halfway in between when your foot hits the ground and when it leaves the ground. And we look at this from a rear view or from a posterior view. So it's right about there. And so what we're going to look at right about there is her knee alignment. And what we're looking for is to see, is her knee diving inwards or toward her midline, the center of her body. And you can see here from this angle, not very much, which is great. So we're trying to avoid that knee diving that direction. And so you can see what we do is we take that 170 degree angle and subtract that from 180. So she has about 3 to 5 degrees of, we call it dynamic knee valgus, or knee movement inward. One thing we can point out here too, we have this nice little knee window. And this is something that's really easy to look at, like from any runner from behind, is can you see light through their knees when they're running? And that kind of indicates they're not getting that inward motion of their knees. The reason this is important is because that knee movement inward puts a lot of stress on the knees. It can put a lot of stress on the hips as well. Highly correlated with injury in research. So a lot of ACL tears, MCL tears happen because of that motion, a lot of meniscus damage. So there's those ligaments in your knee, and then the meniscus, which is that cartilage, and then patellofemoral joint, or the kneecap moving on the leg bone. And those are really common injuries that runners have. And so that inward motion of the knee is what we want to prevent there. And so that looked really good. And then Christie's looked really good as well. So we're going to kind of go through her gait phase, find mid stance right here. And then you can see nice little knee window right here, looks good. And then if we draw this line here, you see she has very, very minimal knee movement diving inward. Part of that's going to be linked to her hip strength. So you can see she doesn't have very much of a hip drop, actually that's a little too much, pretty minimal hip drop there, meaning that her hip muscles on this side are very strong. And then it's also linked to her being able to activate the right muscles at the right time in that gait cycle. So overall, that looked really good. But that's something to look for in a running gait analysis. It's really, really important for pretty much every runner. Like I said, we had to get pretty picky with them, but this is something they did really well. So I'm going to turn over to Austin for a minute while I change back to the.
Yeah, so we're going to switch back to the PowerPoint here, but while he's doing that, we'll just give you guys a quick overview of what we had Carly and Christy work on. So for Carly, our process of analyze, mobilize, activate, and integrate. So for Carly, we found through the analyze that her cadence was a little bit too low, and that she was overstriding a little bit. And during the mobilize and activate portion, we gave her one of our research-based dynamic warm-ups. And she was also letting us know she had some hamstring issues. So we were addressing that with the mobilize and activate part to get all the right muscles lengthened and firing properly. And then the integrate, we had her integrate her new cadence that we calculated for her. And that's actually what she was working on during her run. And that's how she ended up starting to change her stride length and optimize that. And for Christy, so during the analyze part, we were finding that that excessive arch in the low back, and then not fully extending that trail leg, not fully using the glutes and hamstrings was what we wanted to work on. So during her mobilized portion, we had her mobilizing the front of her hip and making sure all the fascia and the muscles and tendons were moving optimally. And then we had her activate by activating her glutes and her hamstrings with a really cool running form drill that we designed for her. And then during the integrate part, we had her integrate that same feeling that she was getting during the drill. So she was using that hip extension. All right, and so now that we've shown you guys some really important components of gait analysis, we want to show you guys something really practical and simple that you can use right away. And that's actually going to be about cadence. And these are things that can decrease injury and improve efficiency. So Chris is going to teach you that.
All right, so it's time to talk about cadence, one of my favorite topics. I could probably talk about cadence forever, probably for over an hour. And so this is the practical component of a lot of this. So this should be something that you can hopefully take away, use later today if you want to go on a run, use tomorrow if you want to go on a run. It's really practical, really powerful stuff. So what I wanted to ask you guys is what do you think the perfect cadence is, or do you have any thoughts about what an ideal cadence would look like? And you guys can type that in the chat, and we can just have an idea. Yeah, so Christy mentioned the 180 mark, and we'll just see as the messages flow in here, we'll just kind of go through some of these cadence slides. So yeah, what we see is, recreational runners around 140 to 170. This is what the research tells us is what people are typically doing. Elite runners are going to be around that 180 steps per minute, sometimes greater. Some of you may know, that 180 number. That comes from Jack Daniels, who was a running coach in the 1980s at the Olympics. He literally just observed a lot of people who were running and said, yeah, it looks like the elite runners are right around that 180 mark. So the question becomes, that's a good point, Kelly. Yeah. What about leg length? I think that's an important consideration. Everyone's different.
Yeah.
And so there's not a perfect cadence for everyone. So there is no ideal cadence for everyone, but you can find an ideal cadence that generally feels best for you and your body. So that would be kind of your ideal cadence for a given set of circumstances, such as speed. Cadence is very speed dependent, and it's very dependent on incline if you're going up or down a hill, dependent on the terrain as well. So these are some considerations. So in general, higher cadences will decrease stress on the body and will decrease certain biomechanical faults that we see. So, if your cadence is fairly low, there really can be huge benefits to increasing your cadence even just slightly. And so now we'll kind of look at those biomechanical faults that cadence improves. So it's this low-hanging fruit that if you really just change this one thing, it can have this big impact on the rest of these areas. So by increasing your cadence, that's a means to decrease overstriding. So if you're an overstrider, then you can decrease that. A loud impact sound. A loud impact sound is correlated with higher impact forces at the level of the ankle and the knee and the hip. So you're going to run a little bit quieter likely if you have that louder impact sound. And then, that force absorption, dynamic knee valgus. Typically, when you when you increase your cadence, you're going to improve that valgus. Same thing with vertical displacement. If someone is bouncing up and down quite a bit, if we simply focus on cadence, a lot of times that will decrease that vertical displacement. And we know inherently that you want to go forward. We don't want too much bouncing up and down. And then we see that increased braking impulse that improves. And then a more narrow base of support that also improves as a result. By increasing your cadence, that base of support may increase a little bit if you're one of those runners that's crossing over quite a bit. And so what we see in research, you don't just want to go, changing your cadence willy-nilly and just increasing it by 20% or just a ton. We want to be really prescriptive about this, and we want this cadence change to be really customized to you. So that's why it's done as a percentage of what your preferred cadence is. So whatever your preferred cadence is, we want to measure that first, and then we're going to increase that cadence if it's in a lower range, we want to increase that cadence by 2.5 to 5 to even up to 10%. But what we see also in the research is that if you increase that cadence by greater than 10%, that increase in cadence is going to actually come at a metabolic cost, and it's going to decrease your running economy. So in other words, the juice isn't worth the squeeze if you're increasing that cadence way too much, like greater than 10%. And inherently, you kind of think of it like, oh yeah, like if I go outside and I'm like really turning over my feet like really fast, and you think like, man, I'm going to get tired if I'm just increasing my cadence, because it does result in faster speed. But like, yeah, it comes a point where, yeah, I can increase my cadence, but you're going to get really tired as a result. And so again, all of this cadence stuff is research-based to decrease your risk of injury and decrease those forces at the level of the ankle, the knee, and the hip. And so this next slide here is really cool. So this is the speed equation. So this is speed equals stride length multiplied by your stepping rate, your cadence. How many steps are you taking per minute? So when we say, when we give you guys our cadence drills and we suggest that runners increase their cadence, we're doing that with the caveat, and this is really important, we're doing that with the caveat that you're keeping your speed constant. So you're running at the same speed, you're increasing your cadence. So if you increase that cadence and you keep the speed the same, then something has to decrease. And in this case, that stride length is going to decrease. And that's when we're affecting the vertical shin bone. So we're making you stride, or making your initial contact closer to your center of mass. And so cadence is a means by which we can decrease that overstriding. We can decrease someone who is overstriding. And so that's really kind of the take-home message. And one other thing I wanted to mention with this, another reason why cadence can be so powerful is because it's a very it's something that we don't have to give a lot of mental force to. We don't have to really think a lot about this gait technique change with your cadence. And so we typically use a metronome. And so that's a cue that's really quick and easy. And when we look at, we know how things would not be successful with changing technique. It doesn't work when you give people this external cue of saying, I just want you to, I want you to strike the ground close to your center of mass. Giving someone a verbal cue like that just simply doesn't work. But cadence is a means by which we can decrease that overstride. So now Daniel's going to tell you a little bit more about how to calculate your cadence.
Yeah. So with all that information, the question then becomes, how can you harness the power of cadence? How can you do this yourself? And so we kind of came up with a method to do that. First, it starts with finding your ideal cadence. So the process for that is going to look like, first you got to calculate your cadence. Then you have to make it a part of your run. And we know there's no perfect cadence, but we can work on finding your ideal cadence. So for finding cadence, step one, you're going to calculate your current cadence. And that's pretty easy. You count the steps on one foot for 30 seconds and multiply by 4. You could also count the steps on both your feet together for 30 seconds and multiply by 2. Either way is going to get you the same result. And that gives you your kind of approximate cadence, or your steps per minute. And then what you're going to do is you're going to calculate a 2.5 to 5% increase. So you can kind of go somewhere in between there. You're going to multiply your steps per minute that you found in step 1 by 0.025 or 0.05. And then you're going to add in your steps per minute again. And that's going to give you your new cadence, or the cadence you're going to experiment with. You can do this also for a 10% increase, but we suggest always starting, especially if you haven't done this before or really changed your form at all, with a smaller increase, because you don't want to change things drastically. Changing your form drastically is a good way to get injured. And so most of the time when you're modifying gait mechanics at all, even to improve it, to give you less injury risk, that sort of thing, you want to do it slowly, carefully, and in small increments. So what if you already have a really high cadence? So some people are close to 180 already, or they're even at 190 steps per minute. What we're looking to do here is really just find your ideal cadence. So you can experience with a slight decrease in cadence too. It's not often that this will be the case. Most runners, most recreational runners are running with a lower cadence than would be optimal for their body. But that is something you can do. You can experiment with a 5 to 10% increase or decrease. And kind of the overarching theme of a lot of what we teach is kind of experiment and see what feels best. Your nervous system, your body will kind of adapt once it's been able to experience different things across the spectrum. So if you increase your cadence some and then you decrease it some, you'll kind of find where it feels best to you. And then your running form will kind of fall into place with that. So how would you do this practically? So we have some mastering cadence drills that we use. And ultimately you would download a metronome, and then we're going to give you guys our ebook called Technique Secrets. And in it, there's these drills that you can go through. And so you can try this on your own. The drill one is learning your new cadence. And so that's essentially using a metronome to get used to learning your cadence. So it's a cadence that you decide, okay, I'm going to experiment with this 5% increase, and then you go and you try it. Then if that feels good to you, you can ingrain it. And when you ingrain your cadence, that's simply slowly taking away the metronome in different increments so that your body starts to get used to running without the metronome. And then maintaining would be the third drill. And that it would be, you have the metronome and it's there still, but you turn it off, and then you check back in every certain amount of time and make sure that you're still maintaining that cadence. Maintaining cadence is really important, especially near, like, say, the end of a race, or when your form is typically going to break down. A lot of runners look great initially, and then their form begins to break down. And so that's something we'll do too, is look at a runner. We might look at them initially when they're fresh, but then also when they're breaking down, when their form is starting to break down. And maintaining cadence can be a good way to help prevent that form from breaking down as well. So let's kind of review everything that we've talked about so far, because it's a whirlwind of stuff. So what is gait analysis? So we kind of reviewed that it was breaking down running form and using slow motion to pick out biomechanics that could be contributing to increased injury risk or decreased running efficiency. And then why do we do it? So what you can measure, you can improve. So if you ultimately, it's for the purpose of having you run longer, longevity, decreasing injury risk, and then really improving your efficiency, making you the best runner that you can be. That's the ultimate goal. And kind of goes along with that is improving your speed and everything like that. Some of the other things we talked about were some of the basics of running gait analysis. Looking at stride, we kind of looked at Carly's stride there, and we saw that initially she had a little bit of an overstride, and then she did some a cadence drill, and it started to normalize a little bit more and become a little more efficient, reducing your risk of injury. That overstriding puts a lot of force through your knees and your ankles up all the way to your hip and your low back, and so it's a great way to get injured if you're consistently overstriding repetitively over a period of time. And so looking at stride length is really important. Hip extension, we looked at Christie's gait for that, and we saw that at toe off, it's important to have your hip fully extended and knee straight, and it facilitates that push off. It can also decrease stress on your back if you have an efficient hip mobility, because then you're not going to have that extra compensation at your low back. And so we talked about that, and then a little bit about the drills she's doing to work on that as well. And then we talked about something they both did really well, that knee alignment. We saw that knee window. That's a really, really easy thing you can look at to say, okay, is this person running, are their knees diving inward or not? And then we kind of looked at the more advanced angle you can draw in a gait analysis to check that out as well. This is one that's really, really important for injury risk. So you decrease injury risk when you don't have that knee diving inward, that what's called dynamic knee valgus. And it also improves your efficiency because you're not losing energy going inward, you're still propelling yourself forward more. Then finally, we got to cadence. It's a really practical tool you can use. Really, there's no perfect cadence like we talked about. Generally, higher cadence is going to be less stress on the body, but then you don't want to go too high because you'll sacrifice efficiency, and it'll be at a metabolic demand or a higher cost to your body in terms of you'll lose some speed if you go too high with that. But small increases in cadence you can do without reducing your efficiency, and it can also improve or decrease your injury risk. Ultimately, we talked about the drills, the learn, ingrain, maintain. We went over those really briefly. And like I said, in the book that you guys can have from us, or the ebook, there's drills that go over that, and you can kind of read those in detail later. So in closing, we just want to say there's going to be this training on WAHOO's website as well, so that you guys can go look at it, and anyone else who wants to, you can refer them to that. And we just wanted to say thank you to the WAHOO community for letting us present. Carly,
Yes.
Christy, and Kelly were great to work with, and they really welcomed us into the community, and we felt very, very much welcomed. It's not everywhere you find communities like this. We've seen different running communities and kind of the lack of involvement and commitment that can be there. And so, I mean, your guys' community is awesome. So definitely, we encourage you to enjoy that and stick with it for sure.
Awesome. Yeah. So if you guys are serious about, avoiding injuries, and, what we were saying is resonating with you, and you want to enjoy running for years to come, and you want to take your performance to the next level, we'd love to invite you guys to sign up for our awesome program, the PR Academy. And so what we have in there are proven, simple, evidence-based methods. And these are things that we designed specifically for people like you guys who are busy runners, and it fits into your schedule, something quick and simple that you can do, and it's specific to you, that will make immediate and lasting changes for you. And so these are things that are going to increase your speed, efficiency, and minimize your injury risk. And we'll be doing that through our process like we were showing you. So the first step is we'd analyze your running gait. We do a full analysis with you, and you'd kind of leave the details to us. But when we talk to you and explain it to you, we're going to point out in a simple way that you'll understand the things that you're doing well already, and then the things that we feel like you could improve upon, the biggest areas for improvement. And then based on that analysis, we're going to come together with a pre-run routine that's customized, so that we figure out how to mobilize and activate exactly what you need right before your run, so your body is primed. And then we'll also create a running form drill that you can integrate a new technique into your running form based on the analysis. And so basically what you're going to get is a 3 to 4 week program that's tailored exactly to your goals and your needs. And you're going to see and feel big improvements, just like all our other runners. And so we wanted to give you guys, the WAHOO runners, a special discount. So it's only $197. You can sign up now. I think Chris just posted a link in the chat as well. So if you guys would like to sign up, go ahead and click on that link. And if you, just for the WAHOO runners, we're also going to give you guys a bonus. So we're going to give you guys the Cadence Kickstart program in addition to this gait analysis and that whole process. And that's an awesome program. It's the same one that Carly was using, actually. And we just love to help you guys take your run to the next level. We've had a blast like putting all this together and figuring out what we wanted to teach you guys, and then just having a blast with you guys today. And we just love helping runners and making a big impact on people. And we'd love to help you take your run to the next level as well. So great. So that was awesome. So let's wrap up here with the Q&A. And so what questions do you guys have for us? We know we covered quite a bit of information there. So we're more than welcome, whatever questions you guys have, and you can unmute if you want to ask your question, or you can just type in the chat. And also we'd like to invite Christy and Carly if you want to chime in, or any further thoughts you guys have.
I have a question, and it's kind of personal to me, and I wanted just
Sure.
to kind of get your guys' feedback. So we saw that I was doing about a 168 cadence, and we wanted to improve it by about 5%. So we brought it up to that 176, and I did that for a few weeks.
Yeah.
I have upper hamstring tendinosis on my left side, but when I corrected that, I got to the point where I wasn't feeling the pain anymore. So of course, then I was like, okay, now I can do some speed. And I went and ran it with Christy, and it was interesting. If I run at like a 7:30 pace, and it was just a straight 7:30 pace for 5 miles, let's say. I just stayed at that 176. It was really easy to know I was at that 176. My watch was telling me, and I just it was easy. But then I did a Track Tuesday workout with her, hit some intervals with 6:30s, like holding them for 5 minutes. And then the rest of that day, I felt it again. It was like, ah, man, it's back. But I couldn't really tell that if my cadence was right because we had walking breaks in between them. So I would go for 5 minutes and then, we'd walk and your cadence would drop significantly. So then the
Right.
overall cadence, I was like, dang it, I don't know if I was on that 176 or not. And I could have been overstriding once again, going into that position that's not, my body wants to go there, but I'm trying not to. And I'm wondering if you have tips or anything of figuring out, do I just need to not go there yet just because it's not healed completely, even though for that little bit I was pain free. I was like, oh, right on. If you have any kind of suggestions there.
Yeah, that's a great question. So the cadence that we were prescribing for you and the cadence how we were describing it in this presentation is for your standard pace, the pace that you're using during the majority of your runs, particularly like your longer runs. So it's not your top speed. So when you were doing intervals, I'm assuming that your cadence naturally was a little bit higher, even though you couldn't get a good read on it. So your cadence, if it's increased like that and you're running at a really high speed, it puts a lot more what's called eccentric strain on your hamstring, because your hamstring is having to contract harder to slow your leg down because your leg is driving up and forward quicker. So I would say I like you, when people are healing from an injury, I like to make sure that the tissue healing timeline is good. So we need enough time where that tissue is offloaded, and then in the meantime you're loading that tissue properly so that the tendon comes back. And then once that tissue healing timeline is solid, which typically is about 4 to 6 weeks for that kind of a tendon, then we can start playing around with the majority of your run. You're using that slower cadence, but then portions of your run for your high speed, you're adapting to a new cadence, which we need to experiment with. So I would say the higher cadence, you probably need to undergo more eccentric loading of that hamstring, and we can assess you further to figure out exactly what your hamstring needs. But we need to heal that first and then start playing with what should your cadence be for that higher speed.
I cut out for a second there too, Austin. You may have covered this, but when a tendon is healing too, something that's important is to so you let the inflammation calm down, and then you have to load it. So you have to eccentrically load it. And Austin may have said that already, but
yeah, I just talked about that a little bit. Yeah.
Okay, perfect. But getting into like a local physio or physical therapist too would be beneficial potentially, because that is something that if it sounds like it's hamstring tendinosis, right? But if there's something else going on too, you'd want to get that cleared as well.
Okay.
Yeah.
Thank you.
Yeah. Any other questions that you guys have? I didn't see in the chat, Chris or Daniel, but
great question.
I saw there were some questions during the presentation. So
let me go back and get into the chat.
And
Kelly, I'm just curious, how many people that are here watching live have ever really paid attention to your cadence? I mean, is that something that you are dialed into, or is that something that's like a new, aha, I probably should be paying attention to that?
Yeah, that's a great question. And something that we wanted to point out as well is so a lot of people are talking about they're using Garmin or Strava or things like that to track their cadence. And I will say that I've tested this personally quite a bit and clinically, and where people have come into me saying they're showing me on their phone, look, this is my cadence. And then I actually have them running and we actually measure it, we count it, because that's the only thing I trust. And I like to measure it when they're fresh as well as when they're a little fatigued. And even when they're fresh, it's often pretty significantly different than what Strava or Garmin is saying. So that's why we're being proponents of actually counting your steps, like Daniel was talking about. Just count on one leg, multiply times 4. You count for 30 seconds and multiply times 4. And it's great to get a gauge of that when you're fresh, as well as towards the end when you're a little fatigued. But it can be helpful to use things like Garmin and Strava, but it's also good to make sure that it's accurate and that it's dialed in with you. Yeah. And the metronome, that always is constant. So. The metronome, that's why. And we also hear from a lot of people that they're trying to use songs and playlists, right? And so one point with that is like, one, it has to be the right cadence for you, right? It can't just be you generically picking 180 or whatever it is. And then two, with the songs and playlists, oftentimes, and I've tracked this before, like on Spotify and whatnot, those, we don't know who made those playlists, right? And the songs are often not exactly the cadence that you think it is. And also for people that are newer to cadence, the metronome is so much easier for you to stay on beat. It's really tough for people that are not as skilled with their cadence, changing it, to use a playlist. It's just not as user friendly. So anyway, so yeah, any other questions about any of that?
Yeah. How long, if you go to change the cadence and you start to use a metronome or you use some sort of running beat or whatever it is, how long until that new pattern is then ingrained to where that's your normal stride length?
Yeah, great question. So what we've seen in all of our testing is that, and what we feel like a lot of people do when they're learning a new technique is like, they'll just kind of do it for, a few runs, and then they'll think they've got it, and then they kind of forget about it, and then they, at some point, they're like, oh yeah, I should check my cadence, and it actually takes a little bit longer. So with our drills, the first drill we do, you're using the metronome the entire time, so it's like blocked practice. Your entire run, you're using the metronome, and we do that for about a week or a week to 2 weeks, right, Daniel?
Yeah, it depends on the runner, but yeah,
a week to 2 weeks where you use it during your entire run. And then after that, another week after that, you're doing the increments. So like part of, for like 30 seconds, you hear the metronome, and then 30 seconds you don't. And then 30 seconds you hear it, 30 seconds you don't. So it's like in intervals. So we start kind of phasing it out in that week 3 or so. And then in week, 3 to 4, we just have you like very randomly checking it. So at random times you turn on the metronome and make sure you're on beat. But for the vast majority of your run, you're not using it. So typically what we see with people is that if you go through that 3 to 4 week process, that you'll be able to retain that skill, retain your cadence for months and months later.
It's very individualized to the runner too. Like it kind of depends on the experience level as well. So we'll find that some we've done something with a runner where they're like in a week, they've got it down, and then other runners it's taken a month, 2 months. We on average it's finding it's about a month to really ingrain that. But then the cool thing too is you can always, and this is something that we want to emphasize, is you always go back and you like running gait analysis it's a point in time, right? And so we like to look at the runner at this point in time, and then throughout the year we would say, go back and every 6 months do an analysis and look at yourself again, and let's see where you're at, because things are going to change. And your cadence should hold, but then if something changes, say you get injured, or say you have a significant increase in power because you change your workout routine a little bit or something like that, your mechanics are going to change with that as well. And so things might change there as well. And so but to answer your question, about a month is what we typically see.
Yeah, about a month. And everything we do, our goal is to make it so that you don't have to think about it anymore. It's just integrated fully into your running form. That's our entire goal. Like, so that's why we use motor learning principles with all of our drills, so that it just ingrains naturally into your nervous system. So you go through this process where you have to think about it initially, and then the next stage of it, it's like you're kind of thinking about it, but it's a little bit automatic. And then the last phase is like it's totally automatic. It's just you just do it with almost like a reflex. You just naturally go to that new cadence or whatever technique it is. So yeah, that was a great question. Any other questions from you guys?
One thing, Daniel, when we initially talked, you talked about differential learning and how I thought that was interesting, that you let people feel what it's like to go to the extreme one way, to the extreme another way. Just like I think about the pelvic moving back and forth, like you're starting to feel what it feels like to be like that anterior pelvic tilt, or just seeing
Yeah.
the extremes and then landing somewhere in the middle that feels more natural, but
Yeah.
set up right.
Yeah, so a lot of our drills are set up with a principle called differential learning, and it's a motor learning principle. And to define those a little bit, motor learning is really your body figuring out how to move. And like we do basic movements very, very well, but then we get to more complex movements like running. Generally, we do them well, and our body learns, and we learn the more we run, the better we get at it, which is why a professional runner is really good at running. One of the reasons. But then differential learning is a technique where you take a skill and then you kind of break it down, and you have someone try the skill one direction. So if we'll use overstriding for the example, that's the one that it's really easy to see, is like, we'll have them say someone is overstriding, we'll have them way overstride, and then we'll have them way understride. And then we'll say, okay, now let's go between the overstride and understride, and let's kind of find a position that feels right for your body. And what we find is that when you do that, so when you expose the body to the full gradient of possibilities, your body will kind of naturally choose the position that is most efficient for it.
Yeah.
And so the question kind of comes like, why don't we always do that? And it's because we don't expose our body to those ranges, right? So it can't learn as well.
Trial and error. And
Exactly.
Yeah.
Our bodies are really, really good at trial and error and figuring out what's right when they're exposed to a gradient of possibilities. Which is why some runners do this better than others. Some runners will expose themselves to a lot of different things, and then they'll kind of find what's perfect for them.
Yeah, and the other reason why we do differential learning is so that you're much better at sensing when your running form is deviating from what's best for you. Because if you've only felt like one thing, like, so if you've only felt like one stride length or like a very close to that stride length, you're not going to be able to recognize like when things are changing, especially towards the end of the run when you're fatigued, or if you're starting to deal with an injury or something like that. So we love building this really good awareness in people so that they're always able to readjust quickly and find when their form is breaking down and find where the sweet spot is for their technique with each important variable. And I think it'd be really fun for us to do a future presentation on how we use differential learning, like a really simple couple of simple examples of how people can use that. That'd be a fun one.
I agree. I know you said it's not that common for someone to have a cadence over 180. I think of one athlete that we had in particular. She was hitting 205. I mean, she was just
Yeah.
She was super fast. I mean, she'd win local races, but you could tell there was potential for her stride length to extend and go a little bit, spread it out a little bit and maybe get your cadence back down. How do you go about getting someone? Because I mean, I would think that the risk of injury is pretty great because their body is not strong enough maybe to handle that greater stride length. How would you approach that?
Yeah, so we make so first of all, when we make changes, we avoid significant changes. And so let's say we had the goal or that runner had a goal of long-term of like, they want a really big stride length. That would come like over quite a long period of time. So we would be, if we did feel like we needed to make increase in stride length, it would be in small increments. But basically like, like we keep saying, it depends on the runner, it depends on their goals. But what we would do is have her experiment with different amounts, but not to like, we would probably have her find something that's not at an extreme. But it depends on things like her soft tissue length, like, how much is she really tight in her glutes and hamstrings, or does she have weakness in her hip flexors? Like, there's lots of reasons why people could have a small stride length. So we'd have to start with identifying why do they have a stride length, because if it's a mobility issue, we have to address that first. If it's a strength issue, we have to address that next. But it could be a nervous system issue. So theoretically, she might have the mobility to do it. She might have the strength to do it, but she's not using it in her motor planning. So that's actually that's why we developed our step-by-step process, because we make sure we're covering the limiting factor basically, but we would make it in smaller increments if that's the goal. Yeah.
That's we just were working with a runner who had the same kind of issue.
Yeah.
So she was probably 200 steps per minute, which it was super fast. And the neat thing too is we can like tell them like, you have a lot of potential to get faster, you know, because like you lengthen that stride a little bit, you're gonna drop some serious time. But then you're right, you have to make sure the body's ready for it. And so that's where one thing that we also want to emphasize is like, running gait analysis is awesome and we love it and it's super important, but like running itself and then strength training are kind of the things like the prerequisites for this, you know. So it's like you have to have a solid base to work on in terms of, you have to be strong in your legs, strong in your core, just to kind of cover the basics. And then you have to also want to run and run significant mileage to get better, you know. And so with someone like that, it's like, if their body's ready for it, then yeah, we can definitely lengthen out their stride a little bit. But then, like you said, if there's a tendency to overstride there, we're going to have to rein it back in, and you kind of find what works best for them. Yeah.
Mm-hmm. Yep. Yeah, absolutely. Yeah. Great question though. Any others?
So I had not really a question, but I mean, I only recently started running like last year, and
That's
I was
awesome.
a really bad heel striker, and I didn't know that I was even doing anything wrong, until I started getting pain. And then I just recorded myself running on the treadmill and looked at some videos of some elite runners, and I was like, well, I'm doing this completely wrong. So then I consciously thought about every step and how I was striking the ground, because playing soccer in college, I did tons of footwork drills and stuff. So I'm very subconsciously thinking about where my foot's going to land, and just having that quick muscle twitch with my foot.
Right. Yeah. You want to take that one, Daniel?
Yeah, sure. Yeah. That is not uncommon to have a heel strike, especially when you start running. And one thing I want to encourage is like, a heel strike is not necessarily a bad thing. So, and we see these elite runners, and a lot of them have a forefoot or midfoot strike, which is great. But the majority of runners heel strike. So like depending on the study you look at, 60 to 95% of runners heel strike. And so we would look at, okay, is it the heel strike that's causing the issue, or are you overstriding a little bit, and that kind of thing. But what was really cool, what you said, is you have a soccer background, and so you've experimented with these things already. And so when it sounds like I wasn't sure if you had changed anything yet, but when you change it, or if you change it, it will be quicker probably, because your nervous system will be quick to respond. You've felt these different things already. And so that's kind of where the individual kind of comes in. You have a background in soccer, so your footwork is a little bit better, so you might be able to adapt a lot quicker and change that. But yeah, I would encourage, like, heel striking is not necessarily bad. It can be a sign of some issues going on in the gait, but yeah, heel strike or a foot strike, there's different benefits to different foot strikes, for sure.
Yeah. And like we look at it on a spectrum. So there's a big difference between hitting on your heel and really significantly versus like you're kind of in between a midfoot and a heel strike, right? They're totally different stress on your body. And so what we've liked with people is like to not significantly change their foot strike fast, because that leads to a quick injury as well. And is not as efficient. So what we do is we have people experiment with different amounts of foot strike patterns. And then what you'll do is with that experimentation, you'll probably find that your sweet spot right now is probably in between a midfoot and a rear foot strike. But It's just to be determined like how much it is for you. And then that's not to say that a little farther in the future, you might keep experimenting with it as your running improves, and you might find, oh, well, now I like more of a forefoot, or now I like more of a midfoot. And again, depending on where in the spectrum, you might find you like different points. But initially, you probably shouldn't make a big jump to a forefoot strike because that could lead to, unless you're doing it during small portions of your run, that's different. But during the majority of your run, you should be kind of experimenting with what works best for you right now, and you'll probably find that sweet spot just by doing that. So yeah, does that answer your question? That was a really good question as well. I know we didn't talk too much about foot strike, but
No, yeah, that's I just I don't know, I like to tinker with things and try to figure out how I can be most efficient.
Yeah, I mean that, yeah, you're exactly the type of people we love working with. That's awesome. Yeah, definitely take that information, and then we'll also we're going to send everybody the link to that book. So we talk about our foot strike drills in that book as well. So you'll like that. Definitely. Cool. Anything else from you guys? Great questions. And I think are Carly and Christy still on as well?
Yeah, they are.
Yep.
Cool.
Yep.
Okay.
Well, thank you guys. Very, very.
Great.
Oh, did somebody else have a question?
It was me, CT, just saying thank you.
Okay.
Yeah.
Thank you very much. I mean, it was, I've been running for almost 30 years, and I, for the most part, have been injury free that whole time. But it's amazing how when you take the opportunity to just take a glance at what you're doing, I mean, like the restriction in my hip that you guys sniffed out, I didn't know it was there. I thought I was fine, but there's potential, I mean, to extend that out, to make things a lot better. So just
That's awesome.
how often do you recommend, like quarterly, to kind of touch base with your stride and record yourself, or do you have a recommendation?
Very much up in the air. It kind of depends on the runner and kind of what they're doing at the time. So like if you're running, I mean, if you're running 30 to 50 miles a week, I'd say it wouldn't be a bad idea to check in with your running gait every quarter. I'd say more like twice a year would be kind of a more realistic. If I were like training for, if I'm putting 100 miles a week, I'd want to make sure I am dialed in. So maybe a little more frequently, with that. But kind of depends. I would say probably at least twice a year. That would be a good thing to do.
Yeah, and then as far as like the timing, if somebody is starting to feel some discomfort somewhere, like it's not fully injured yet, right? But like you start to feel something that's a little off, don't let it linger. Like these things usually don't go away. Running is repetitive, and so it's probably going to keep getting worse. If it happens to go away on its own, great. But personally, with all of the people we see in clinics, we highly recommend that if you start to feel some pain somewhere, especially as you're increasing your mileage, that's a really good time to check in with us and get your gait analyzed. And really just anytime you have a major change in your either your duration of your running or your intensity. So maybe people are preparing for a race and they're starting to bump up their mileage or whatever it is. Maybe they're just trying to PR in something. Anytime you're changing your intensity or duration significantly, that's another really good time to get a gait analysis. So, yeah.
Well, thank you guys so much. It's been great.
Yeah,
absolutely.
Thank you. Thank you guys. Yeah, this is such a great community. We just love it. So it's been a lot of fun.
We appreciate your time and your knowledge and just, your expertise. So hopefully we send some people your way. I think all of us can benefit from going through this process.
Yeah.
So
yeah. Oh, it's great. Yeah.
We're awesome. Excited to kind of be a part of the community too, because it's been fun to get to know you guys for sure.
Yeah, absolutely. Cool.
Happy training to all.
Thank you. Thank you. And back at you. Thanks for making us better.
Absolutely. Bye, guys.
Bye. Have a good night.
Bye.